We move on to the next oration, that is Dr. K.L. Chopra Memorial Oration. It's the American Association of Cardiologists of Indian Origin at WCCPCI. And may I invite Dr. I.P.S. Kalra and Dr. Sumita Chaudhary and Dr. R.A.I. Ekanayaka to kindly join the proceedings on the dais. For the next 20 minutes, we have Professor Dr.H.K.Reddy, who is the Medical Director of the Cardiovascular Institute of Southern Missouri, and he is at the St. Louis University of Medical School and the President of the American Association of Cardiologists of Indian Origin. Professor Reddy joins us this morning to speak for the next 20 minutes on gigantic strides in cardiovascular disease therapy, from pills and potions to drugs and devices. What's in store for the future? May I request the chairpersons to kindly...
One word about Colonel Chopra, or Dr. K.L. Chopra. He was one of the most brilliant physicians of the Indian Army and a cardiologist. Then he was the head of the Department of Cardiology at Mulchan Hospital, and he devoted his whole lifetime for the in the research of a coronary artery disease. And 1984, I was also involved with him. For the first time in the country, the streptokinase was used under his guidance in Mulchan Hospital in case of an acute myocardial infarction. So because of his contribution to a coronary artery disease, an oration was given in his name, mainly pertaining to a coronary artery disease, and I think no better person than Reddy to give this oration. That was just an introduction of the name of the person like Colonel Chopra, who he was also.
Yeah, I'd request the chairpersons to kindly step forward and
present. Dr. Colonel Chopra was my senior in Air Force, and he was my mentor. So I request Dr.
May I request the chairpersons to kindly step forward and don him with a medallion and the citation, Dr. Chaudhary and Dr. Kalra, to be joined by the President of CSI and the Congress Chairman, Dr. Chopra. Professor Reddy, please.
Respected Chairman, Dr. Chopra, Dr. Parashar, Dr. Nanda is not here, and Dr. Gupta, I highly thank you. I am highly grateful for this honor bestowed upon me. I don't know whether I deserve it or not. I thought in the next few minutes I would go ahead and summarize the tremendous progress human beings have made on this planet Earth in the last just few thousand years, 5,000 years. So I'll go through multiple slides. I'll just flash them, just make sure that I just tell you what happened a long time ago and what's happening now and what will happen in the next 50 years. So as you can see, to my knowledge, you can actually verify that, human beings on this earth have been, at least as we know, the way we look, we act, the so-called genus Homo, we have been here on this earth planet for 250,000 years. Of course, humanites, people like us were there for 2.5 million years, maybe longer. Nobody exactly knows how long we have been here. But 250,000 years is a long time. And then if you think about it, what have we done for 250,000 years? Not much. In the last 5,000 years, we have done some progress. We have made some progress. In the last 400 years, we have made a revolutionary progress. It is amazing what has happened. It's unthinkable, unimaginable. And the next 50 years, what will happen is going to be very different. The conference in 50 years from now will be entirely different. We won't be talking about this. We'll be talking about entirely different material. It is coming. So in the next 50 years, electronics, micro devices, body bots, the small robots going into the body, genetic profiling and repair will radically improve human life and will lengthen the life and also make it better, whether we like it or not. But like I said, we have been in the dark period for a long time. to take you back to the prehistoric period, of course, you can watch movies on Netflix. Is not here yet, but you can watch some of those things. In the first years on this earth, the human beings were, of course, not clothed. They didn't have any food, no farm, nothing, no cities, no nothing. So they just stayed in one, they didn't stay in one place. All the time they have been on this earth were spending to looking for food, gathering food, and looking for food. And of course, the first documented civilization, believe it or not, was Hindu civilization. And some people will disagree with that. It was 6,000 years before Christ was born. Hindu kingdom was the so-called Aryan kingdom. They say, consensus is it originated in the northwest province of India. Aryans were the horse-mounted warriors. They were like Asian Vikings, except that they're highly civilized, very highly civilized, spiritualistic, high standards, everything was high. And some people actually now doing research on this topic, they think they were aliens. There's a lot of evidence pointing to that. They were aliens who came from other planet. They have been here, then they left. I don't know what happened. We don't know what happened. And Ayurvedic medicine was their forte, and the various herbs were discovered. There were potions were given. Surgical techniques were discovered. And this was, actually, this is a typo here. 1,000 years before the Egyptian emperor, Manetho ruled. So we predate Egyptian people. And of course, they say that Brahma delivered Ayurveda, the science of life, to Surya because he couldn't see the human being suffering. The first Hindu physicians, Dhanvantari and Atreya, have brought a cup of Amrita, the honey, and taught surgery to Susruta. Susruta Samhita, the first surgery textbook in the history of human race. And of course, they have several disciples, including Agnivesha and Harita, who wrote books on ophthalmology, heart and blood vessels much before Western people. So these people, these are documented books available on this. And of course, then Egyptians came. Egyptians, 1,000 years after that, and their fortes, pyramids, and their civilization, there's their document, their script, the Egyptians. But we had script before them. And of course, this was the first one of those kings, so-called Imhotep. He was a god of medicine of Egyptians, and that was 500 BC. And he was also engineer. Also, pyramids were, built by them. He was astronomer, architect at that time. And then, of course, Hippocrates, the Greek people appeared 1,000 years following Imhotep. Then they wrote several textbooks. The Egyptians wrote textbooks. They call them papyri, several medical papyri. We don't want to go into details because in the view of time. Then some of these are important. Cahun, the gynecology, internal medicine, herbal medicine, and they're all, you can find them in London Museum. So it's interesting how primitive they were at that time. Contraception, applications for contraception, crocodile dung, 45 ml of honey, sour milk, testing for pregnancy. But that's all they could do at that time. And also I just put these slides on because to tell you, they were also looking at anatomy and physiology. They were just dabbling with that. They were not sure what they were looking at. You can see the gaping wound in the skull and this and that, rending open the brain of his skull comes up to you can feel the brain with the finger. But it didn't make much sense, but they tried to do that. Anatomy, physiology, they also said, is there that heart speaks? Is that every physician, every priest of Sekhmet places fingers, feeds something from the heart. There are vessels in every part of the body. So they were trying to define all these body parts at that time. It was a long time ago. And mummification was their strength at that time. And so the medical papyri, they also documented the first physical examination in the history of human race, inspection, palpation, and other modalities of examination, percussion, examine the belly, knock on the finger, place the hand on the patient and tap. Hernias, they diagnose hernias. And cervical vertebra, if we move or look up and down with cervical vertebra, that means you don't have a fracture, but now we don't do that. If you do that, you get sued because you may develop paralysis. And the surgical instruments, the prehistoric instruments, they were kind of rough. Don't use them now, but of course, they were available at that time. And also surgical needles. Examples of papyri, they have some, medications for constipation, berries of castor tree, chew and swallow down with beer. You may not agree with that. And if not effective, add castor oil. Diarrhea, they have onion, cooked gruel, honey, migraine, fish and fat and oil, all the stuff, Then primitive times, they also believe in supernatural spirits and demons. And tribal doctors perform some ceremonies. Actually, to be honest with you, I grew up a little bit like this too, in a village here where I grew up. So herbs and plants were used. And also, they identified diseases, though. They splintered fractures. And they used bloodletting for pulmonary edema, for heart failure. They didn't have any diuretics at that time. They did bloodletting. And also, the Chinese came along. They used acupuncture. They treated disease with stone tools. They had stone tools. And Greeks came along. Greeks were the first Western medicine, the beginning of the first Western medicine. They had knowledge. They rationalized medicine. Hippocrates from 460 BC to 370 BC. And Galen, they actually focused on disease, the cause of disease, and also physical examination and drugs and medicines they used. The code of ethics, the Hippocrates ethics, even now we take it and we don't follow, most of us. And of course, he dissected animals, not the human being yet. And of course, they wrote books along with his disciples like Dr. Chopra and Dr. Randa are doing, and Dr. Parashar are doing. They had they believed that disease is caused by something. It's not natural, it's not spirit, it's not superstition. And Romans were even more civilized. Of course, the Greeks helped them organize medicine. Early hospitals came into being, developed sanitation systems, and Dr. Galen was the first one to dissect human body, and of course, and then he also did bloodletting thing. It appears crazy. I did do bloodletting in New York City one time, a heart nephrology, a renal failure patient, because we couldn't pass urine, and we couldn't do dialysis emergently, so we have to do bloodletting, to take blood out. Of course, they used leeches. Indians used leeches too. And the Romans also drained swamps to stop malaria. They did, they discovered surgical tools. And but then after that, after Romans came along, for good 1,000 years, a long, long time, then nothing happened. Because if you do some things, you were punished. You were hung to death. You were punished. You were put in jail. So monasteries and all these religious people were practicing medicine. Unfortunately, because of this dark period, 75% of the planet's population succumbed to death because of bubonic plague, tuberculosis, smallpox, typhoid. Can you believe that? We can't even imagine that. So that happened there, dark Middle Ages. Then, of course, the Renaissance comes along, and that's the birth of the science, medical science, as we see right now, rebirth of science, medical schools, study of the body by dissection. That's how we became doctors, allopathic. Microscopes were invented, and the printing press were also invented. And doctors studied human anatomy. The age of enlightenment began, and of course, a lot of developments took place. Multiple people from all over Europe, all over the world, were discovering things simultaneously. And then Leonardo da Vinci, who everybody knows, studied and recorded anatomy of the body very clearly, and Industrial Revolution contributed heavily to medical field. Millions of lives were saved. Doctors worked in hospitals. They know how to keep everything sterile, clean. Bacteria and viruses were discovered. And invention of printing press, you can see the monk copying a paper there. William Harvey in the 16th, 17th century discovered circulation, as we know around, pumping heart and circulation. And of course, the Leeuwenhoek invented a microscope. Benjamin Franklin, in addition to discovering electricity in his own way, he invented bifocals because he couldn't see. And many more inventions at that time. Laennec discovered stethoscope, as you all know. Florence Nightingale was the first nursing school. Nursing school started during the Crimean War. And she made nursing profession an honorable profession. And Clara Barton started Red Cross. Louis Pasteur, of course, discovered the microorganisms cause disease. He's the father of sterile precautions. Lister used antiseptic during operation to prevent infection. Robert Koch discovered microbiology. And Röntgen, chest X-rays were discovered by Röntgen. Thanks to Röntgen, we can do now CT scans, everything, cardiac cath. Without him, we wouldn't know what we would have done. We wouldn't be doing it. Sigmund Freud was the one for the pioneer in psychology and physiology and psychiatry. And Alexander Fleming discovered penicillin. Of course, now modern times, lasers, MRIs, X-rays, save millions of lives, literally. Now, of course, Heberden, 1768, discovered the concept of disease came into being, symptoms. Dr. Heberden discovered angina, the constrictive feeling in the chest. His description from 1768 still true. Is still true. How chest pain occurs, the pressure, a patient feels like he's dying, and also Dr. Osler he worked extensively on angina in 3 continents in the perfected medical field, clinical medicine, and Now, 1900 marked a period of great interest. Association of Heart, American Heart Associations began in New York City in 1924. Then, of course, these are the pioneers. Einthoven discovered the electrocardiogram in addition to other people. And, of course, Dr. Forstemann, Warden Forstemann was the first person to put a catheter, central line into the patient's body, and he was fired for that. Of course, Andrew Cournon came along, and Dr. Dickinson Richards from New York, from New Jersey. Then after a few years, 30 years later, they confirmed what Dr. Forstemann did, and then they all got Nobel Prize. All these pioneers, Mason Stones perfected cardiac cath technique, Andreas Grunzig did the first PTCA, Julian, David Cushman, Dr. Black, Ondetti, Okara, Endo, they all discovered medications and pioneers in the cardiology and medical field. Dr. Cannell did epidemiological studies, the so-called, the Framingham study. Paul Dudley White, everybody knows. Paul Zoll, and all these people who actually brought forth echocardiogram was Dr. Adler and Dr. Hertz, the first echocardiogram. And post-World War, after Second World War, America became #1 country in the world. Before that, it was 17th or 27th in the world order. And then the consumerism, how the consumers like India is doing right now, all the consumers want everything. So that's how started happening in the US. So that's how the economy boomed. And UK became a socialistic society, and they were providing health care to everybody. America and US and European countries, they rationalized medicine and allopathic medicine. Here we are right now, the best discoveries of the last 400 years: electrocardiography, preventive cardiology, Framingham study, lipid hypothesis, coronary care units, echocardiography, thrombolytic therapy, Dr. Srinivas Kumar already alluded to, cardiac catheterization, coronary angiography, open heart surgery, automatic implantable cardiac defibrillators, angioplasty stents, biodegradable stents, all kinds of stents, and of course, honing an indigenous stem cell therapy, where we're coming right now. There are two types of doing this. So stem cells, you activate the indigenous stem cells. You only came from one cell. If you think about it, you only came from one cell. So we have several cells like that right now circulating. We don't know how to hone them. But I think one of the things that definitely work is yoga and exercise, meditation have been proven to work on stem cells. And they have shown multiple times, multiple papers. And they are trying to hone your own stem cells to repair your own body with the laser therapy, some kind of chemical emails. They're working on the active field of research right now. And of course, the externally injected stem cells have problem working because they don't know how they have to hone, they have to tag onto the indigenous cells and try to locate where the repair is needed. And of course, the technology also has improved, is improving very fast. TAVR, percutaneous closure devices, successful ablation of arrhythmias, heart transplantation, artificial hearts. And people are being taught wellness, how the prevention is the key. And if you think about world map of average life expectancy, with all these developments, in India, we stay in the middle, right here somewhere. Sorry. We stay in the middle here. And but you can see the blue color, that's in Canada, Australia, and of course the European countries where the social welfare is there. As those countries, these are the longest. If you think about it, I think America is not at the top of the list. America still is the blue. So we live longer than Canadians, Australians, and Europeans and Middle East, some of the Middle East people. I think there's only one common theme. I think stress factor is the problem. America has a lot of stress, even though your money won't prolong your life. But stress shortens your life. So meditation, peace, and all those things are extremely important. In the future, next 50 years, what do you hold in the next 50 years? You can expect prosthetic limbs. One of them can be prosthetic arm. You can see that. You can expect small so-called nanobots in your blood. They might inject small nano robots into your blood, and they go and repair your heart. They may open the blockage. You don't need stents anymore. You don't need cardiologists. You may need cardiologists, but not interventional cardiologists. You can print your heart, like you have heart is failing and your heart is only working 10%. You order a heart somewhere in somewhere in Japan, maybe in Hyderabad or Delhi. Then you order, it'll be grown, and then they give it to you. So that will happen, whether we like it or not. And of course, other therapeutic strategies are exploding. And like we talked about, the honing the indigenous stem cells and also injecting them from outside. The other thing is micro devices we talked about. They inject micro devices, and they will not only detect disease but also cure them and provide medications. For example, in this here, you can see this the devices are summarized here. Micro devices, monitors, they go into the body, they detect, make a diagnosis, they send the diagnosis to the computer, central computer, they deliver drugs to the command of a doctor, and they give you hormones like thyroid hormone, insulin, and these are coming. It's already making, some of them are made, this is being made. This microchip has chambers and channels together with the micro pumps, the micro valves, heaters, and with the polymerase chain reaction, even small drop of blood can be analyzed for biochemistry with this thing. And of course, in addition to ICD, LV assist devices, we have stem cells transplant, xenotransplant. We might also transplant animal organs like from the pigs to the human beings, but we are not there yet. It's coming in the future. Tissue regeneration. Regeneration is the key in the future. It promotes synthesis of chemical, these micro devices will promote regeneration. They promote synthesis of antibodies against infection, against pneumonia, and also if you have trouble sleeping, they might make you sleep in seconds. You improve eyesight, even get cheered if you're not smiling. If you have trouble smiling, they will make you smile. Bioelectronic devices promote mind-body interaction, eliminate impulsive and aggressive and violent behavior. Can you believe that? So devices stimulate production of natural agents. So also one more last thing is gene-informed therapy. They will profile your genes. They're already doing it in oncology and other fields. And they will, both based on your genetic makeup, some drugs may not work on you. It's called so-called gene-profiled smart therapy, gene-informed personalized therapy. So then, for example, alpha addition is a cytoskeletal protein involved in cell signaling. A variant of this gene is present in about 1/3 of hypertensives. And they promote sodium reabsorption by distal tubules. Like that. That is an example how gene-based therapy is already here. And medical practice in the near future, in 50 years or 100 years, will be entirely different from what we are doing right now. Life will be longer, people will be longer, 150, 160, 200 years. And don't be bashful. You have a right to live longer. Bhishma and Dronacharya lived longer. I think they were aliens. Life will be longer, life will be better, and it will be the paradise, the golden age will come back again. So the paradigms will change whether old timers like us will like it or not. Thank you very much for your attention.
Friends, I hope you have enjoyed the journey from the ancient time to the recent times. He has very nicely brought out the facts. See, we should be proud of our Indian contributions. Rustam Jal Vakil, our great cardiologist, he introduced Revolfia for hypertension. Lately the S-amlodipine, the chemistry of calcium blockers, that is also introduced in India. The greatest contribution is of Raj Yoga, which is being practiced here. And this is the need of the hours. And the other day, yesterday, it was brought out that methi seed is a good omega-3 source, very simple and cheap. And I want to tell you that the concept of Florence Nightingale was already there in India by Kanhaiya's time in 16th century, when the soldiers were being treated, the foes, enemies and the friends were treated equally by the forces by Kanhaiya in the Guru Gobind Singh's war against the tyranny. So you must have seen that in India, our ancient physicians, the surgeons, Sushruta. But the sad point is that our rulers, and even now, we are making more gurdwaras rather than studying Guru Granth Sahib, our Vedas, our mandirs. We need to study Gita more than worshipping, just bowing about Lord Krishna's statue. And the research at that time was not sponsored or supported by our kings, which was a mistake, which we should learn from our mistakes. Anyway, Dr. Reddy has brought out a very nice, and there is a stimulus that we in India, we must ourselves practice Raj Yoga, meditation, and also spread this message to the world, which is already being done by this sort of organization.
Thank you, Dr. Reddy, for taking us through this amazing journey, and I don't know anyone who could have done it better. And now that you've told us all the amazing things to look for in the future about nanobots and 3D printed hearts, could you also venture to comment on possibilities of even our doctors in the future seeing creations such as Terminator and time travel? Is that something that you can also predict?
Oh, yes. Actually, I didn't touch that because of time. I thought time constraint, but I think it's already going to happen not too long from now. Only, 20 years from now, actually, in your lifetime for sure. Hopefully in our lifetime, it's already happening. The space medicine is coming. They're already going to zero gravity. They're testing all the medicines and everything. And as you saw, Interstellar, the movie, some of you watched, if you go really fast in space, you can become younger. You can become younger. You can do that too. I forgot to mention, since we have some time now, Hindu Kingdom, it was documented by actually Dr. Hostler's fellows in Oxford. Hindu Kingdom extended up to Greece. Greek was, somebody might disagree with me, Greek was a part of India, and also the kingdom extended up to Rome, and Iran was a part of, Prussia was a part of India, and Indian Hindu Kingdom, the Aryan Kingdom extended far and wide. And some of these people, they say Greeks and Indians live together. Persians, Greeks, Indians live together. So they have a huge influence from Hindus. I'm not promoting, I'm not saying Hindus are better than anybody else. I'm just giving the history. And also, when I went to Cambodia, I saw a huge influence. Thailand, Philippines, Hindu temples are there. Angkor Wat. It's amazing. What a civilization. And now there's a huge group of people that are doing research on this topic, and they definitely thought the aliens came, because it's not possible by ordinary human beings what they did. They always describe in Vedas how the people came from the skies, and there are a lot of vimanas. Pushpaka is only one vimana, but there are many vimanas. If you go to Google, you can look it up. There are many vimanas, all the parts, darpanas, like the rotors of the vimanas, they're all there. Parts were there. They discovered them. It's amazing, though, what they did. So I think the golden age is coming to India again.
Thank you very much, Professor Reddy. Heartiest congratulations. Thank you, Dr. Kalra and Dr. Sumi.